Hi, my name is Dr. Ali Naderi. I'm from Case Western Reserve Metro Health Medical Center. We are at ACC 2017, and I have the pleasure of having Dr. Paul Sorajja with us today.
Good morning. How are you?
Not too bad. Thank you for having us, and thank you for your time. Can you please tell us about the data that you're presenting, TVT registry for mitral clip?
Sure. So today we're going to be presenting at the late-breaking clinical trials. The study we're presenting is a one-year follow-up study of commercial transcatheter mitral valve repair with MitraClip in the U.S. What we did is we looked at patients through September 2015 in the TVT registry, and we linked their data to CMS administrative claims data, and we looked at the procedure success, 30-day and one-year outcomes.
And what were the implications and the outcomes of this study?
Yeah. So in the TVT registry, there were just under 3,000 patients who had MitraClip, and in those patients there were about 1,900 who had one-year follow-up. And what we found was that in the TVT registry, the success rate with MitraClip was 92%. In-hospital mortality was 2.7%. At 1 year, about 1/4 of the patients died, and about 1/5 of the patients had heart failure rehospitalization. So it was actually very interesting because there were also some procedural and patient characteristics that were predictive of the one-year outcomes. So patients who are older, patients who had lung disease, dialysis, and the degree of residual MR, all were predictive of the one-year outcomes.
And is that something like TAVR that seems to be expanding to more broader patient population? Is that something that you would predict would happen in the future?
Yeah, I think it's a good question because certainly the technical success is improved. There are debates about what the definition of acute procedure success is with MitraClip, but I think at least in the population that we studied, these were patients who were high or prohibitive risk. These are no option patients. I think in patients who don't have, or patients who do have the surgical option, that remains to be studied because there is a perception, and rightly so, that with MitraClip you don't get the same MR reduction that you do with surgery. And I think really you need to have the science there to compare what MitraClip would be in comparison to surgery. It's been done in the low-risk patients in the Everest trial essentially, but in the more intermediate or high risk, I do think that that's an area that needs study.
And I suspect there would be more data in terms of longer-term follow-up, and that will be presented later on.
Yeah, and I think I think the most important data that need to be looked at now are, we know that 1/4 of them die at 1 year, and we know that there are morbidities that drive that prognosis. But I think we have to understand, well, if 1/4 of them dying, what would be the outcome if we did not do anything, and what is the improvement in quality of life in these prohibitive risk patients? So I do think that those areas are in need of study, and the long-term follow-up, like you said.
Thank you so much for your time. For more videos, please visit youtube.com/FITSontheGo. Thank you.